hospitals across the southeast of England have begun cancelling non-urgent operations, with some struggling to cope with double the number of COVID patients they had in the spring. It comes as government sources confirmed tonight that there is concern about the new variant of COVID-19, amid fears it could be making the virus more infectious and harder to contain. Today, the Prime Minister said he was hoping to avoid a third national lockdown in England, but acknowledged that rates of infection had increased very much over recent weeks. New data suggests the UK's R number, or reproduction rate of coronavirus, is on the rise again. Last week, it was thought to be between 0.9 and 1. It's now estimated to be between 1.1 and 1.2. Anything above 1 means that the virus is growing. Here's our health editor, Hugh Pym.
Routine operations were going ahead at this hospital in the south of England today, but increasingly NHS managers across the system are having to consider postponements. More COVID patients are coming in, and it's a challenge to find enough beds, and that's causing problems in A&E as well.
We're now at a really dangerous point where we could tip into finding it incredibly difficult to manage. Now we've got crowded departments with COVID as the additional burden, which is a really scary and challenging place to be. And you can see this as we're increasingly getting ambulances queuing outside departments.
One COVID patient at this hospital has made a plea for families to think very hard before travelling at Christmas. He thinks his teenage son may have unwittingly passed on the virus.
If you saw the look on my son's face when I was fighting for my breath, you would not be wanting to send these children all over the country to see their family.
The Prime Minister, on a visit to the North West, did not rule out the possibility of England following Northern Ireland and Wales into a post-Christmas lockdown.
Obviously, we're hoping very much that we'll be able to avoid anything like that, but the reality is that the rates of infection have increased very much in the last few weeks. Here where I am in the northwest in Bolton, they've actually done a fantastic job in bringing it down.
And the data shows that case numbers are rising in most, but not all parts of the UK. The latest survey of community infections by the Office for National Statistics suggests that in England, 1 in 95 people had the virus last week, with an increase in case rates. Notably in London, the South East, the East and the East Midlands. There were declines in other areas. In Wales, with 1 in 90, and Scotland, with 1 in 100, there were also increases. In Northern Ireland, 1 in 215 had the virus, with case rates no longer decreasing. Inevitably, some of those infected will become seriously ill and need hospital treatment, and that's what's putting pressure on the NHS front line. There have been warnings today about the impact on staff.
People from the first surge are still very traumatised and fatigued, not only from physical tiredness, but from the psychological impact of dealing with COVID and working in very different ways to usual. Now we're looking down the barrel of what looks like a third wave. So we're very concerned, and the impact of 5 days over Christmas is something we're very concerned about as well.
Many hospitals across the South East are under increasing strain. NHS leaders in Kent say they'll cancel some non-urgent operations because of the increase in COVID patient numbers. And as in other areas, they need to be ready for a possible surge into the new year.
And we'll have more from Hugh in a moment. But first, the latest government figures on coronavirus show another rise in infections. There were 28,507 new cases in the latest 24-hour period. The average number of new cases reported per day in the last week is 23,959. The number of people being admitted to hospital is rising too, 1,707 on average each day between now and last Sunday. 489 deaths were reported for the last 24 hours, and that's people who died within 28 days of a positive COVID-19 test. On average, in the past week, there were 434 deaths per day. The total number of UK deaths is now 66,541.